Welcome to the University Eye Hospital here in Bochum, Germany. We are here to conduct a femtosecond laser-assisted cataract surgery using the Helix from the company Elasis, followed by a cataract surgery with the implantation of an EDOF IOL that is named Elion from the company Medicontour. So let me introduce the Helix surgical laser system. It's a mobile system that can be easily removed from A to B. It consists of a console. This console has an integrated battery pack, and this battery pack lasts for more than 100 procedures. That means more than several days without any power, and it can be charged overnight to repower it to full. It also comes with some spacers depending on the anterior chamber depth. And in this case, it's 2.9, and we adapted it with a spacer that's attached to this handpiece. This handpiece here can be moved. It is 2 kilograms light, and is implemented here. And then we're going to start. So I first introduce a lid speculum into the eye. That's not necessary, but I prefer it because in cases of conjunctival chalasis, it's easier then. Then we have the interface. This interface comes with a curved interface, which is then attached to the eye. And we check for the meniscus. Once the meniscus is fine, I keep it in this position and take out the handpiece after activating the system. Insert this laser into this interface. And then we are going to check for the centration. Now I look through the ocular because we also want to take care of the parallaxis and laser. And that's it. Take out the laser, take out the interface and place it back. And the lasing is done. And we can then move the laser away to another patient after taking out the lid speculum, closing the eye, and move it away to somewhere else. Okay, now we're going to do the surgery. So this is a nice view here. You can see the capsulotomy of this patient, and we are now doing the paracentesis at 3 and 9 o'clock. I'm sitting at the 12 o'clock position, and we are using the so-called dimple down technique, just to make sure that everything is free, and then directly the hydrodissection and delineation. Okay, visco. Filling the anterior chamber with OVD. And main incision at 12 o'clock with 2.7 millimeter incision. And then I will take it out. Usually we don't take it out, but we are conducting a trial regarding the size, centration. And here you see the nice capsule, which is then now taken out. I think were able to see that this was nice cut, and just rotating the lens. It's free, as you can see. To just get rid of the lens, which is nicely emulsified in the anterior chamber, or pupillary plane, as you can see here. And done. Next step, bimanual irrigation aspiration. which is nice because it allows you 360-degree access through the cortex. And now comes the injector, which is a nice injector. The lens is an, as I said, EDOF IOL. It comes preloaded, as you can see here, and works extremely well. The release is very good. And due to the slow glass transition time, the unfolding is extremely good and controlled. It fits through a 2.2 millimeter incision. Here in this case, we have a 2.7 millimeter incision. So you see it's without any additional maneuvers. It perfectly fits into the anterior chamber and now slowly releases nicely into the bag. And the intention is to directly implant it into the bag, but it does not work all the time, maybe because of the live surgery here. And now it's in the bag. I'm just flushing out the OVD. I'm also flushing out the OVD behind the IOL, of course, using bimanual irrigation aspiration. The lens, as I said, is unfolding extremely nicely and centering extremely well. And it's hydrophobic acrylic IOL, one-piece, sharp edge posterior design. Comes also as in toric versions. And Medicontour, of course, delivers it worldwide. But Medicontour is a 100% European company, as you all know. And some flushing of the surface. And here you see the optic of the lens and the nice, perfectly. In terms of quality, look at how nice it is. It is really good. And there was, in no case, there is a laser-induced meiosis or something like that. And the quality is extremely good of the cut. You can see it here. And I think it's very perfectly. It needs some training in the beginning, of course. That's what I learned already. But then it's outstanding. If you follow the steps I mentioned beforehand, and you see very nice. And that's exactly what we want in our patients, I would say. And the case is done. Thank you so much for your attention.